Today I'm going to be talking about vancomycin. Vancomycin was discovered in 1953, which was then approved for medical use in 1958. It was made by the soil bacterium Amycalotopsis orientalis, which was found in a sample collected from jungles in Borneo. What does it target? It targets serious gram-positive pathogens. It has a narrow spectrum. It targets penicillin-resistant S. aureus. It targets bacteria that is resistant to B-lactam antibiotics. Vancomycin is considered the last drug resort because of overuse. It can lead to resistance, and it can also cause some serious side effects. The indications: it is used to treat life-threatening C. diff, which is associated with severe diarrhea. Vancomycin is also used to treat methicillin-resistant Staphylococcus aureus infections such as pneumonia, sepsis, or endocarditis. Vancomycin is also used as an alternative for patients that are hypersensitive or allergic to penicillin. It also treats enterococcal infections. Its main target is gram-positive infections. Vancomycin is poorly absorbed when administered by mouth. For synthetic infections, IV is the best route. It is distributed by body fluids or tissues. It penetrates into most of the body fluids. There is minimal metabolism since it is not metabolized by liver or other organisms. Vancomycin will be excreted by the kidneys through glomerular filtration. This also means it can cause nephrotoxicity. So, side effects. What are some side effects? It can cause CNS effects such as headache, dizziness. If it is administered orally, it can also cause pain such as abdominal pain, nausea. Since it is excreted through kidneys, it can cause nephrotoxicity. It reduces kidney function. Hearing loss, known as ototoxicity, can also be a side effect. This is rare but common in older patients in prolonged use. Vancomycin causes red man syndrome, which is a flushing rash, itching, which causes hypotension. Red man syndrome is managed by slow infusion rate and per-medicate histamines. If known allergy, it can cause hypersensitivity. Contradictions. Some contradictions for vancomycin are the use on a patient that is allergic due to the increase of hypersensitivity reaction. Vancomycin should be avoided if severe red man syndrome reactions cannot be managed. If vancomycin is being used in non-indicated infections, it can develop resistance. Cautions. Caution should be used on patients with renal impairment, hepatic impairment due to hearing loss increase. If a patient is pregnant, it can hurt the fetus. Older patients are more at risk to increase of side effects such as nephrotoxicity, ototoxicity, which are the two main ones. Doses should be reduced for these patients. Interactions. Vancomycin has interactions with drugs that also increase nephrotoxicity, such as non-steroidal anti-inflammatory drugs, aminoglycosides, loop diuretics. It also increases ototoxicity with the aminoglycoside and the loop diuretics. Anesthetics can also be another interaction. During surgery, it can increase risk of red man syndrome due to the histamine release. Vancomycin may also enhance a neuromuscular blockade, which leads to prolonged muscle weakness. Food interactions. There's not really no food interactions. Vancomycin does not have any effects since it is if it is administered through mouth. Food does not alter its efficiency. Drugs with nephrotoxic potentia are Stolochia, which increases its risk. Creatine supplements can also enhance nephrotoxic effects. Biloba is a herb that can increase risk of ototoxicity or bleeding complications. Echinacea interacts unexpectedly with immune response, reducing the efficiency. Vancomycin is part of the glycopeptide antibiotics. It inhibits bacterial cell wall synthesis, which is effective for gram-positive bacteria. The main common route for vancomycin is in IV or intravenously. It ensures therapeutic levels in bloodstreams and tissues. Oral route is only used to treat C. diff, which is the infection found in the GI tract. Peak levels and durations. Peak levels are typically achieved 1 to 2 hours after the IV infusion ends. The typical therapeutic peak range is 20 to 40 milliliters. Peak levels are measured to access the highest concentration of the drug. Durations depend on the infection that vancomycin is targeting. Most are limited to 48 hours, or it can be days or even weeks. Dosing frequency is every 6 to 24 hours based on the infection. For pneumonia, duration can be 7 to 14 days. For uncomplicated sepsis, duration can be 7 to 14 days. And if it's severe sepsis, it can be 4 to 8 weeks. Since vancomycin is excreted through the kidneys, renal function should be monitored to avoid nephrotoxicity. Tests can be done for this. Levels of vancomycin should be monitored to ensure drug is working and to avoid toxicity. Peak levels target 20 to 40 milliliters. High doses or prolonged use will increase hearing loss, so it should also be monitored. Older patients should be monitored since they are at higher risk. Patients that already have these complications should also be monitored. To conclude, vancomycin is used as a last resort to high risk of complications. Those should be reduced with any disease that can increase risk of any toxicity or increase of side effects. It is a treatment to treat gram-positive bacterial infections. Proper monitoring should be used to avoid toxicity, and the understanding of the concepts of vancomycin will minimize harm.